Myself, Dr. Rahul Kr, Sinha, MD Medicine, PNB Cardiology, as practicing cardiologist. So today we want to talk about the hypertension on the occasion of World Heart Day, because hypertension is so much prevalent and common problem in our society, and in fact, it's a very much in hidden forms. So today in this video, I want to sort out many of the queries by the general peoples who asked about the hypertension. So first of all, what does it mean to be have hypertension? What is this hypertension means? So each time the heart beats, the heart pumps blood into the vessels. This creates a pressure in the blood vessels. So that pressure is known as blood pressure in the vessels. Normally, in a healthy person, blood pressures generally falls, rises throughout the day according to the person's activity. It may be down when the person's sitting quiet in the room, but maybe high up when he is doing some stressful works. But when blood pressure persistently remains higher for a longer time or a continuous duration, this condition known as hypertension. As many of know, the normal blood pressure is the 120 millimeter, 120 by 80 millimeter of mercury. So blood pressure, any blood pressure more than 140 by 80 millimeter of mercury for persistently longer period, that condition is identified as hypertension, जिसको हम लोग कहते हैं high BP. So second question, what are the conditions and what are the risk factors that can cause the hypertension, high BP conditions? So this type of risk factor can be identified in two forms. First of all, modifiable. Second is non-modifiable. Modifiable factor that can be modified, that can be controlled by the person's choice, person's will, like sedentary lifestyle and any type of person who do not involve in any physical activity. It's a very common risk factor in nowadays, especially in urban populations. Excessive alcohol intake, eating junk and fatty foods, smoking tobacco. It's very common in young urban populations, now very much common in even village population also in younger age group. So third one is obesity and overweight. And last, the constantly under stress. These are the modifiable risk factors for the hypertension that can be controlled if a person wants to control his blood pressure. So what are the signs and symptoms of high blood pressure? Actually, high blood pressure develops over time. Most of the time, there is no obvious sign of hypertension. So you must know that if any person having risk factor, it must be measured his BP. As most of us know, BP hypertension also known as silent killer. Many of the hypertensive patients do not know about his condition of this disease. So any person who having more than 40 years of age, any of these all risk factors should constantly monitor his blood pressure to identify this condition. When symptoms do occur, they include morning headache or tiredness, vision changes, buzzing in the air, fatigue, nausea, and vomiting. If a person is experiencing this type of symptom, they should be checked his blood pressure. But most commonly, this hypertensive patient do not have any symptom, mind you. So what are the signs and symptoms of blood pressure? If blood pressure can cause symptoms, so it can be vision loss, headache, tiredness, fatigue, tinnitus in ear, nausea, and vomiting type of feeling can be caused. So if any person having this type of symptom, must be check his blood pressure. Last is how to protect your heart from high blood pressure. So hypertension can be prevented and reduced by taking small steps adapting normal healthier lifestyle, like eat well balanced diet that is low in salt, less than 5 grams per day salt, limit alcohol intake, stop smoking, take your medication properly. If you are hypertensive, then take medication very properly, manage stress, and in regular do the regular exercise. So these are the very easy and lifestyle modification that can be controlled hypertension. If blood pressure is successfully controlled with a healthy lifestyle, then it might avoid, delay, or reduce the need of medication. So high blood pressure can be controlled in many ways, like keeping blood pressure in the normal range, very important in preventing cardiovascular complication. It is very much possible to maintain normal blood pressure level with regular monitoring and preventive care. So message is, if you having any risk factor and more than age more than 40 years, check your BP regularly. And if you have high blood pressure, then you adapt a healthier lifestyle and control your blood pressure to avoid the cardiovascular complication. Thank you.